Thanks. Thank you for the introduction. My name is Kwame Liddell, and I'm the founder of Nutrible. You might see in this presentation some verbiage that says dispatch care, and it's because we rebranded from dispatch care to Nutrible, and we're going through that process. And as you learn more about our platform, you'll understand why. So Nutrable was founded while the idea for Nutrable came while I was an emergency nurse. I traveled around the country and worked in big cities on each coast and all over. And I cared for patients. And there was something that I saw consistently. I cared for hundreds of patients who prematurely lost their lives or their livelihood due to strokes and heart attacks that were completely preventable. Most of these patients, they knew they had high blood pressure or high cholesterol. And myself and my colleagues and the doctors in the hospital, we worked really hard to educate patients. But even if we provided education inside of the hospital, we had a really hard time access to healthy food.
Your sound just cut out.
Kwame, I'm pausing your time.
To
Kwame?
Healthy food.
Time out.
Yes.
We lost about the last minute of your audio.
Yeah, I think my computer connected to my headphones, even though they were in the case. Can you guys hear me now?
Yeah.
Yes, we can. So if you could rewind yourself right about 45, 60 seconds, that would be great, because I know we don't want to miss anything.
Yeah, sure. Nutrible, the idea for Nutrible was founded while I was an emergency nurse. I traveled across the country. I cared for patients from coast to coast in the South and in the Midwest. And there was one consistent thing. We saw hundreds of patients who prematurely lost their lives or their livelihood due to preventable heart attacks and strokes. And my colleagues and the doctors I work with, we worked really hard to ensure that patients had the education while they were in the hospital. But when they left, there was limited education resources and access to healthy food in the community. And there was one patient in particular that was really motivated, who really wanted to adjust the way he ate, and he had difficulty even when he understood what he should be eating, he had trouble actually finding the food in the community. And in his community, it was called a food desert. And a food desert is a place there is a large population of people, but there's limited access to actual healthy food. So in his place, the place where he actually gained access to food was a local convenience store that had mostly fried and processed foods. And his community was not unique. There are more than 6,000 food deserts throughout the country. Throughout those communities, more than 20 million Americans, particularly with low income, live in those areas. So we created Nutrible to solve the problem directly. Through one platform, every patient has access to healthy food education and access to the actual food. That's what makes us unique. So in the past, even the patient that I used the example of, even though he had education, he didn't have access to food. And in other communities, even if they don't live in a food desert, they'll understand how the food impacts their lives, and they still have the same outcome. The problem is so robust that even during COVID, heart disease, which includes heart attacks and strokes, was still the leading cause of death in the United States. So we created Nutrible. It utilizes it connects the electronic medical record and the doctors to the food banks and grocery stores in the community, so that patients can have access to it all in one place. It's very easy to use. Patients can connect to it by phone or through the platform, with or without a referral. They could actually schedule a meeting and have access to a dietitian within 24 hours. And the platform is very, very easy to navigate. It only takes about a minute and a half to schedule the initial visit,
And from then, once they have their account set up, they're able to, it's easy for them to set up follow-up visits and connect with their dietitians over time. Some of the great feedback that we're getting from patients and our first partners is that the self-scheduling is available, so patients really have control of how they get access to their dietitians. The phone visits are important because many of the communities that struggle with this problem have limited technology. So being able to use just any cell phone, even if it's not a smartphone, is hugely important. And flexible appointments, including weekends. Many people who suffer from these diseases actually work in their, and many times their schedules are variable. So just a simple 9 to 5 availability, it can oftentimes be hard for them because they'll have to miss work to actually make their appointments, even though it's virtual. And there's also a picture of Nija. She is one of our dietitians. She has a great story, and I added her to this page because she's also one of the big reasons that patients really enjoy this platform, is because minorities, particularly African Americans, have twice the likelihood of having a stroke within their lifetime and 3 times as likely to die from a heart attack. So many of the patients who will utilize our app in the organizations that we partner with really needed support from diverse dietitians, for people who understand the community and understand the culture for patients that we care for. Our first one big milestone was our first partnership with Alameda Hospital and the Alameda Food Bank in the Bay Area. It's this health hospital system first time, even though the food bank's only about 3 blocks away, they never had a formal connection. So when patients go into the emergency room, the doctors can send a referral with just a click of a button, and those patients now have access. Patients who need it have access to the food bank and dietitians really easily. Our business model is very simple. The one that our hospital partners enjoy the most is the flat rate to $2,500 a month. It's about that amount, which is less than half of what it would cost for them to hire a dietitian to do this work. And we're able to provide even more resources and more flexibility than they could even if they hired a dietitian. A person would have to work 24 hours a day. Is a huge opportunity. $10.5 billion is just people who currently, right now, today, are already covered by health insurance that would cover these services. So this is a snapshot of people right now who have Medicare, who, if they wanted to use it, their insurance would pay for it today. Here's studies. Health systems are trying to solve this problem. They've done it through manual labor, hired lots of people to try to create systems like this. It's been really cumbersome for the hospitals to do it, but those who were able to do it have all had incredible savings. Advocate Chicago saved $4 million in just 6 months by doing this. Catholic Health Initiatives did it in Kentucky, and Johns Hopkins has done it as well. There are just so much research now that shows something that seemed obvious. If you get patients healthy food, then they will be healthier and have better health outcomes. Our team is well equipped to develop our platform and continue to grow. We have great development and startup experience, as well as a wealth of healthcare operations experience. And I thank you all for your time.